Hi, this video is about the frequently asked Viva questions and answers under complete denture prosthodontics. So first is definition of prosthodontics. Prosthodontics is the dental specialty pertaining to the diagnosis, treatment planning, rehabilitation and maintenance of oral function, comfort, appearance and health of the patient with clinical conditions associated with missing or deficient teeth and or maxillofacial tissues using biocompatible substitutes. What are the branches of prosthodontics? Prosthodontics can be divided into 4 branches as removable prosthodontics, fixed prosthodontics, implant prosthodontics and maxillofacial prosthodontics. Removable prosthodontics can be further divided into complete denture prosthodontics and partial denture prosthodontics. What are the aims or objectives of prosthodontic treatment? So these are restoration of missing structures, restoration of function, restoration of aesthetics, restoration of phonetics and preservation of remaining structures. Definition of a complete denture. A complete denture is a removable dental prosthesis that replaces the entire dentition and associated structures of the maxilla and mandible. What are the steps in fabrication of a complete denture? So it includes clinical steps and laboratory steps. So various clinical steps are diagnosis and treatment planning, diagnostic and primary impression making, secondary or final impression making, jaw relation records, denture tie-in, denture insertion and follow-up appointments. The various laboratory steps are fabrication of a diagnostic cast or primary cast, fabrication of custom tray, master cast, fabrication of a record base and occlusal rims, mounting of occlusal rims on articulator, arrangement of artificial teeth, processing and finishing or polishing of the processed denture and laboratory remounting. What are the surfaces of complete denture? So complete denture has 3 surfaces. Impression or intaglio surface is that portion of the denture surface which has its contour determined by the impression. Polished surface is that portion of a surface of a denture which extends in an occlusal direction from the border of the denture and include the palatal surface. It is the part of the denture base which is usually polished and it includes the buccal and lingual surfaces of the teeth. The occlusal surface is that portion of the surface of a denture or dentition which makes contact or near contact with the corresponding surface of the opposing denture or dentition. What are the parts of a complete denture? A complete denture has a denture base. It is that part of a denture which rests on the oral mucosa and to which teeth are attached. The denture flange is the essentially vertical extension from the body of the denture onto one of the vestibules of the oral cavity. The denture border is the margin of the denture base at the junction of the polished surface and the impression surface and denture teeth. Different anatomical landmarks of maxillary arch. So anatomical landmarks can be classified into 3 categories as limiting structures, stress bearing areas and relief areas. The limiting structures are labial frenum, labial vestibule, buccal frenum, buccal vestibule, hamular notch and postpalatal seal area. The primary stress bearing areas are posterior lateral slope of hard palate and maxillary tuberosity, and secondary stress bearing area is palatine rugae. Relief areas are incisive papilla, mid palatine raphe, fovea palatini and torus palatinus. Anatomical landmarks of mandible. So in mandibular arch, the limiting structures are labial frenum, labial vestibule, buccal frenum, buccal vestibule, retromolar pad area, lingual frenum, alveolingual sulcus and pterygomandibular raphe. The primary stress bearing areas are buccal shelf area and retromolar pad area. The secondary stress bearing areas are lateral slopes of residual alveolar ridge. The relief areas are mental foramen, genial tubercle, mylohyoid ridge and torus mandibularis. Definition of an impression tray. Impression tray is a device used to carry, confine and control the impression material while making the impression. Classification of impression trays. So it can be classified on the basis of their use into stock or prefabricated trays, custom trays, sectional trays and triple trays. On the basis of material used for their fabrication, it can be a metallic tray or it can be made up of a shellac based plate, resin or plastic, and the stock trays are further divided into perforated and non-perforated stock trays. What are the ideal requirements of impression trays? The impression trays must be rigid. Flexible trays cause distortion of impression. It should be dimensionally stable. It should provide uniform space for impression material. It should be smooth to avoid injury to oral tissues. It should not distort the impression in vestibular region. It should support the set material when removed from the mouth so that a cast can be poured, and if needed it can be modified. What are the advantages and disadvantages of a stock tray? So a stock tray is rigid and supports the impression material. It is dimensionally stable and can be reused. The different disadvantages are that the space between tray and tissue is not uniform. The flanges are over or underextended, and it is difficult to relieve the non-stress bearing areas. What is a custom tray? Custom tray is an individualized impression tray made on a cast recovered by pouring a primary impression. Different materials which can be used for fabrication of custom trays are tray compound, autopolymerizing denture based resins, shellac based plate, vacuum formed thermoplastic resin sheets, light cure acrylic resin, and old dentures can be used as custom trays. What are the advantages and disadvantages of custom trays? The advantages are that it provides a dimensionally accurate impression because of the uniform space available between tray and tissues. The flanges are properly extended and the non-stress bearing areas can be relieved. The disadvantages are that it can be used only for individualized patient. The fabrication is a time consuming process, less rigid than stock trays, and dimensional stability is less compared to stock trays. What are the functions of a spacer used in custom tray? So a spacer helps in providing the space for final impression material and for selective relief of the relief areas. For selectively relieving the relief areas. What are the functions of tissue stops? So tissue stops help in stabilizing and orienting the custom tray during impression making, and it helps in providing uniform space of 2 to 3 mm between custom tray and tissues. What is an impression? Impression is a negative likeness or copy in reverse of the surface of an object. What are the objectives of impression making in complete denture? So these are retention, stability, support, aesthetics, and preservation of remaining structures. What is retention? Retention is the quality inherent in the prosthesis which resists the force of gravity, adhesiveness of foods, and the forces associated with the opening of the jaws. Various factors which affect retention of a complete denture prosthesis. So it includes anatomical factors such as size of denture bearing area and quality of denture bearing area. The physiological factors which are related to the quality and quantity of saliva. Various physical factors such as adhesion, cohesion, interfacial surface tension, capillary attraction, and atmospheric pressure and peripheral seal. The mechanical factors like presence of undercuts, retentive springs, magnetic forces, denture adhesives and suction disc, and muscular forces which are related to the neutral zone area. What is stability? Stability is the quality of a denture to be firm, steady or constant, to resist displacement by functional stresses and not to be subject to change of position when forces are applied. What are the factors which affect stability of a complete denture? So these are vertical height of the residual ridge, quality of soft tissue covering the ridge, quality of the impression, occlusal rims, arrangement of teeth, and contour of the polished surfaces. What is support? Support is the resistance to vertical forces of mastication, occlusal forces, and other forces applied in a direction towards the denture bearing area. Muller-Devon's dictum is, the preservation of that which remains is of utmost importance and not the meticulous replacement of that which has been lost. Different types of impressions for complete denture patients. So impressions can be classified on the basis of theories of impression making into mucostatic, mucocompressive, selective pressure impression theory, myostatic and dynamic impression theory. On the basis of technique used during impression making as open mouth technique and closed mouth technique. On the basis of type of tray used for impression making, it can be made with the help of stock tray or custom tray, and the basis of purpose of the impression, it can be a diagnostic impression, primary impression or secondary impression. The various materials which can be used for making primary impressions are impression compound, alginate and putty consistency of elastomeric impression material. Various materials which can be used for making secondary impressions are zinc oxide eugenol impression paste, light body of elastomeric impression material and monophase consistency. What is border molding? Border molding is the shaping of an impression material by the manipulation or action of the tissue adjacent to the borders of the impression. Various materials which can be used for border molding are green stick compound and polyether elastomeric impression material. Definition of a dental cast. Dental cast is a replica of the tooth surfaces, residual ridge areas and or other parts of the dental arch and or maxillofacial structures used to fabricate a dental restoration or prosthesis. What are the parts of dental cast? So dental cast has two parts, anatomic portion and art portion. The anatomic portion of dental cast is made by pouring impression of oral tissues. It represents anatomical landmarks of denture foundation area. The art portion is added to anatomic portion of cast to provide better strength and handling characteristics. It includes base of the cast, heel of the cast and land area of the cast. What is a record base? Record base is an interim denture base used to support the record rim material for recording maxillomandibular records. Classification of record bases. Record bases can be classified on the basis of the material used for their fabrication as metallic and non-metallic record bases. So example of metallic materials are cobalt chromium alloys, nickel chromium alloys and gold alloys. The non-metallic record bases include self-cure acrylic resin bases, heat cure acrylic resin record base, shellac record bases and base plate wax. On the basis of their use, it can be classified as temporary and permanent record bases. So example of temporary record based materials are self-cure denture based resin, shellac and base plate wax, and permanent denture bases include heat cure acrylic resin denture bases, cobalt chromium alloys, nickel chromium alloys and gold alloys used for denture bases. The ideal requirements of a record base should be well adapted to the oral tissues and the cast. It should be rigid and dimensionally stable. It must reproduce all the anatomical landmarks accurately. The border should be smooth and rounded so they do not injure the oral tissues, and it should be easily removable from the cast. What are the advantages and disadvantages of metal denture base? The advantages are that they are dimensionally stable, they are good conductor of heat and can be given in patients who encounter frequent denture fractures or allergic to denture based resins. The disadvantages are that their fabrication is a time consuming procedure, the relining is difficult and cannot be given in patients allergic to metal alloys. Definition of an articulator. Articulator is a mechanical device which represents the temporomandibular joint and the jaw members to which maxillary and mandibular casts may be attached to simulate jaw movements. Classification of articulators on the basis of theories of occlusion. Articulators can be classified into three types as Bonville theory articulators, conical theory articulators and spherical theory articulators. On the basis of adjustability, articulators can be classified as non-adjustable articulators, semi-adjustable articulators and fully adjustable articulators. What are the uses of articulators? Articulators are used for diagnosis, treatment planning and patient presentation in both the natural and artificial dentitions. To plan the dental procedures, they are used to aid in the fabrication of dental restorations and lost dental parts, to correct and modify completed restorations, and for teaching and studying of occlusion and mandibular movements. What are the limitations of articulators? Articulators are subject to error in tooling and to error resulting from metal fatigue and wear. It does not completely replicate the condylar movements in the temporomandibular joint, and the movements simulated are empty mouth sliding motions, not functional movements. Thank you.